See, this is why I always feel like it's always one of those things that as nurses, we always got to come and try to fight for our respect and prestige because we have people like Yas who is out here making us all look bad. Okay. So, if for those of you who don't understand, this video is about Yas, who I believe she goes by the name of Yas Scott. When she was passing medications on TikTok Live, she got a lot of flack from in the comments and she placed herself in hot water. For those of you who don't know who I am a nurse practitioner. I am also a nursing professor at a local university, and I'm a registered nurse, still working at the bedside. So let me just explain to you why this is an issue. Okay, first of all, you are a health professional. Okay, you are live passing medications. You have committed a merit. She committed a med error on live, saying a patient's first and last name. Okay, showing how she was very frustrated and irritated with a lot of the comments who were basically telling her, you know what you're doing is inappropriate. So, Yas was passing medications on TikTok Live, okay, when she was saying the patient's first and last name. She also placed, I believe, a lidocaine patch on a patient. I believe it was at the wrong time, which is a medication error. She downplayed this medication error by saying it was only a lidocaine patch. But think about all of the patients who have passed away at the hands of a nurse from a medication error or has passed away at the hands of a physician or surgeon because of some type of medical error. As a nursing professor, we do not train nursing students to pass medications with the distractions in an environment that can take your mind off of focusing on what you should be doing for the safety of the patient. There are 4 steps that you need to follow when you pass a medication. One is you need to check the patient's chart. You need to make sure that those medications are ordered for the right patient. You need to check the allergies. You need to know the patient's medical history to make sure that you're not giving seizure medication to somebody who doesn't have seizures. You need to understand these things. The second thing is once you have verified the orders against the medication administration record, you go into what's called a medication room. You pull medications out of the Pyxis. As you're pulling them out of the Pyxis, you verify again against the chart to make sure that you're pulling the right medications out of the Pyxis for the right patient. Okay, making sure you check expiration dates, making sure that the medications are not damaged. Once you do that, your third step is going to be to recheck everything to make sure that you pull the right amount of medications out. You're making sure that you pull the proper medications out with the right route. There are 6 rights of medication administration that we have to follow. This is where you're going to check that in this third step. If you pulled 6 medications out of Pyxis, then you should be leaving the med room with 6 medications. Okay, you shouldn't be leaving with 8. Okay. Fourth check is once you get in the patient's room, you should be identifying your patient by the name and date of birth. You should be scanning all the medications. You obviously need to scan the patient's wristband before you give these medications, and you need to scan all the medications. Okay. And before you actually hand those pills to the patient, you should be going through the list again to double check to make sure that there were no new orders placed by the provider and to make sure that no orders were discontinued, because there are times we could go in the med room, we could pull a medication. By the time we get to the patient's room, it's been discontinued. So that is what you're supposed to do at your 4th check. You can't do all of this stuff with distractions. Okay, you can't be talking to people, you can't be on the telephone, you can't be on live, you can't have people asking you a bunch of questions. This is why a lot of times nurses don't answer their phones. We have to walk around with phones sometimes because if we're in the middle of passing medications, we can't be distracted. This is just like when other staff, they're trying to pull us away to do something in the middle of our medication pass. That is unsafe. So what Yas was doing on TikTok Live is a complete violation of what we train nursing students to do. Now, she gave a lidocaine patch at the wrong time. That is a violation of the 6 rights of medication administration. She did not give it at the right time. So any one of the 6 or all of them is a violation of medication administration. So yes, it's a medication error. It doesn't matter what type of medication it is, doesn't matter if it was a cream, doesn't matter if it's something topical, it's still a medication error and it's supposed to be reported. And what do hospitals do? Your manager looks at how many errors, medication error you're causing, because you can't be unsafe for the patient. So yes, she committed a medication error. And for her to downplay it the way that she did just kind of speaks to either her immaturity level or just her not having really the knowledge that she should have. And it could be a lot of because she was distracted. The next thing is she's frustrated with people in the comments who are specifically telling her what you're doing is inappropriate. So she's irritated. She's saying she didn't violate HIPAA. But again, which leads me to the HIPAA. Yes, she violated HIPAA by saying the first and last name of this patient on a public social platform for all people to hear. One thing, you cannot do things you're not authorized to do. Did she get authorization from her health, care organization to videotape this particular procedure? Did she get approval from the patient or family members to partake in this procedure on live? Do I think that she should lose her nursing license for this? Absolutely not. There are healthcare providers that have done absolutely worse and have not lost their nursing license. Should she be terminated for this? I can't say that. I'm not the one to make that decision, but there are always consequences behind your actions, and you should be reprimanded or you should face the repercussions behind your actions. And whatever that should be for her, that should be determined by the organization in which she works for. But we need to make sure that we use this experience as a way to know that this is not how we are supposed to function. So if you're a nursing student, or if you're currently a practicing nurse, or if you're a nurse content creator or healthcare content, healthcare worker content creator, you have to be careful what you do, what you say, how you do it. And remember that these are patients on the other end of this. And if you put yourself on the other side, you got to ask yourself, how would you feel? I would like to know from Yaz, like, if this was flipped around and, she was the patient, how would she feel knowing that a nurse is, videotaping her interaction online and it's going across all types of social media platforms, and she didn't give authorization. I can't assume that that patient gave her authorization or did not. I don't know. I cannot assume if the healthcare organization gave her authorization or not. I don't know. But what I can tell you guys is let this be a learning lesson for you, what you should not be doing. So I hope this helps you all, and I hope you like this video. Subscribe and comment.